A young man took the blue pill for a better sex life, but it landed him in the emergency department with a 7-hour painful erection. Sildenafil-induced priapism is a rare but dangerous urologic emergency, and by the end of this case study, you'll know exactly why it happens and how it is treated. History of present illness. A 34-year-old male presents to the emergency department complaining of a persistent, painful erection that started approximately 7 hours ago. The patient states that in an effort to enhance sexual performance, he took one 50 mg sildenafil tablet orally. He subsequently developed an erection that has persisted even after achieving orgasm and became painful, which is localized to the penis. He denies any preceding trauma to the genital region. His vital signs did not show any significant abnormality. Genitourinary examination showed that the penis is fully erect, markedly rigid, and tender to palpation. The penile skin is intact with no signs of bruising, laceration, or external injury. No dysuria, hematuria, urgency, frequency, or other urinary symptoms. No urethral discharge noted. Scrotum and testes are normal on examination. No past medical and medication history. Only admitted for taking a single dose of sildenafil today. No known drug allergies. Diagnosis. Sildenafil-induced ischemic priapism. Priapism. The term priapism is derived from Priapus, the Greek god of fertility, gardening, and lust, who is typically depicted with a massive phallus. There is no uniform temporal definition for priapism. Most studies describe priapism as an unwanted and painful erection that lasts more than 4 hours, and it is unrelated to sexual stimulation. Priapism is traditionally categorized into ischemic priapism, or non-ischemic priapism subtypes. Non-ischemic or high-flow priapism is a rare and congenital condition that is not the focus of our discussion in this case. Ischemic priapism, or low-flow priapism, is most commonly associated with sickle cell anemia or drug-induced ischemic priapism. Ischemic priapism is associated with significant penile pain, full penile rigidity, and extreme tenderness. In rare cases, ischemic priapism can present with penile gangrene, resulting in necrosis of the entire penis. If untreated, ischemic priapism may result in permanent erectile dysfunction. Our study patient had no significant medical history, presented with ischemic priapism symptoms following use of sildenafil, and was diagnosed with sildenafil-induced ischemic priapism. Painful ischemic priapism that lasts more than 4 hours is a clinically significant but rare side effect of sildenafil. For understanding how sildenafil induces ischemic priapism, I must briefly explain how normal erection occurs. Sexual stimulation triggers a cascade of events that leads to the release of nitric oxide, activation of the guanylyl cyclase enzyme, and increasing cyclic guanosine monophosphate levels, resulting in the relaxation of blood vessels and increasing inflow of blood to the corpus cavernosum. All these events result in penile rigidity. There is an enzyme named phosphodiesterase 5. This enzyme is responsible for the degradation of cyclic guanosine monophosphate, which consequently reduces the level of this cyclic nucleotide and impairs erectile function cascade. Sildenafil inhibits the action of this enzyme, increasing the level of cyclic guanosine monophosphate, and initiates the cascade of erectile function to the penile rigidity. Therefore, it helps to improve sexual performance. Although sildenafil has a beneficial effect on sexual performance, it can rarely induce a painful erection that persists beyond orgasm, which is an ischemic priapism. In ischemic priapism, prolonged relaxation of penile blood vessels prevents the veins from opening. This traps blood, leading to anoxic tissue damage, increasing penile muscle pressure, and compartment syndrome, including significant penile pain, rigidity, and tenderness. The onset of sildenafil-induced ischemic priapism is rapid, shortly after orgasm. Risk factors include sildenafil overdose. Concurrent medications that may cause priapism, for example, amitriptyline, nortriptyline, second-generation antipsychotics, and trazodone. Management of sildenafil-induced ischemic priapism. For ischemic priapism less than 24 hours, number 1. Cavernosal aspiration with saline irrigation. Number 2. Intracavernosal injection with sympathomimetic agent, for example, phenylephrine. This is associated with more rapid resolution of priapism, less erectile dysfunction, fewer side effects. After performing all these medical interventions, if the priapism persists, then the patient needs to be prepared for surgery.
Thanks for watching. If you found this helpful, hit the like button and please subscribe to get future video lessons.